This is John Chowning for Dialogue on Public Issues with Campbellsville University. Welcome back to our segment today, and I'm very pleased to be interviewing a very well-known and highly respected member of our community, Ms. Jane Wheatley, a civic leader, member of our Board of Trustees, and CEO of Taylor Regional Hospital. Jane, welcome.
Thank you.
It's good to have you back.
Thank you. Glad to be here.
Tell us a little bit about yourself. I think most people around Campbellsville know who you are, but there might be one or two.
Well, I'm a graduate of Taylor County High School and also a graduate of Campbellsville University, and have lived in Campbellsville now for 50 plus years, and so this is home. I'm originally born in Ohio, and my father was a Baptist minister, and he moved back to Campbellsville when I was in high school. So that's how I got back home.
Reverend George Gaddy.
Yes.
One of the great men of the church.
Well, thank you. I think so.
Absolutely. One of the great ones. Now, you've been at Taylor Regional Hospital how long?
41 years.
Okay.
I've been the CEO actually for 17.
How are things going there?
They're going very well. We've had a good year. There's been struggles. There's a lot of things going on now politically. A lot of changes are coming across, but we're doing very well.
You mentioned that a lot of facilities and the complexities of healthcare policy in the United States today. What are some of those problems or issues challenging healthcare and that Taylor Regional Hospital has to contend with?
Well, there's a large population now in the Medicare and Medicaid rolls, and there are constant cuts coming to those programs as more people become eligible for Medicare. Medicare spending, there are more cuts coming, and they are covering less things. And then there's a whole section now of people that are on the Medicaid program, and that is solely funded by state and federal government, and so there have been cuts that have come in those programs as well. So we continue to see the population of patients increase, but the money that we're receiving back is continuing to decrease.
And how is Taylor Regional doing, contending with all these factors in play? And this is not just affecting Taylor Regional, it's affecting hospitals of all sizes.
Right. I think the thing that helps us the most is our very strong physician base. We are able to offer so many different specialties at Taylor that a lot of the smaller hospitals aren't able to do. So having that strong physician base, we're able to keep up with technology, and that's the name of the game now. People want to go where they can have surgeries or treatments with top-notch equipment and top-notch physicians, so we're very fortunate that we have both.
Now, what level of care is provided at Taylor Regional, and how does that compare with other facilities in our general area?
We're very fortunate that we have a lot of specialties that the surrounding hospitals do not have. We have 4 general surgeons, so they are doing most surgeries. They are at the hospital. The main thing that gets transferred out is going to be hearts. We have a diagnostic cath lab, however, we do not stent and we do not do open heart surgery. So if a patient comes in that needs those services, they're going to be transferred out. We are a trauma center, however, if there is head trauma or there is life-threatening trauma, most of the time they're going to go to a level 1. The 2 level 1s in this state right now are the University of Kentucky and the University of Louisville. So those patients usually go out by helicopter, or if they can't go by helicopter, they go by ground for further treatment. We don't do head trauma, we don't do back and spine trauma, but most everything else we can take care of.
Taylor Regional just recently added some major innovations. You mentioned technology being the name of the game. Just a few months ago, you added the Da Vinci Robotic Surgery technology. Tell us about that, and why did this become necessary?
It's a very exciting day. We debated and talked about it as a board and administration for a couple of years. It mainly was used at first by urology, and with Dr. Ben Angel, who is Dr. James Angel's son, who is our original urologist, coming back to Campbellsville to practice, and then his sister, Meredith Angel, joining us this summer for those procedures in urology we felt like we needed to move ahead. At that time, we thought urology would be the primary user of the Da Vinci. It has turned out that general surgery is using it actually more than urology. Dr. James Watkins embraced the new technology. He has become very proficient on it. He is doing colon resections, he's doing gallbladders, he's doing hernias. And then Dr. Ben Angel and Dr. Meredith Angel are also doing urologic procedures on it. When you say robot, people get this idea in their head that this machine's coming up to their body and operating on them. That's not how it works. However, a physician is sitting at a console, and he is able to turn 300 or 180 degrees, I guess, up and down to be able to make smaller incisions. The outcomes have been tremendous. People are going home the same day. Surgeries that used to, they would stay overnight or they'd have a longer recovery period. They're recovering much faster. So it's been very popular. I'm sure we're getting close to the 100 mark of surgeries that we've done.
So it's much less invasive than the traditional surgery would be in terms of incisions and that sort of thing. And as you said, a quicker recovery, quicker turnaround in terms of going home.
Right.
And all of those are advantageous to the patients. And I might add, as I understand it, the patient doesn't cost the patient any more than a more traditional surgery.
That's correct.
So the hospital is really not, quote, making more money off of a procedure by going with this.
No, and we're not reimbursed any more money.
Right.
They pay this. Insurance companies pay the same thing whether you have it, what they consider open or endoscopically, or whether you have it robotically. It's just better for the patient, better recovery, less hospital time, just a better all-around experience for the patient.
It has basically become the state-of-the-art, the prescribed technique for many surgeries.
We knew that if we didn't embrace the new technology, that facilities larger than us, the facilities in Louisville, Lexington all have it. Actually, there's one in Elizabethtown as well. We knew in the future when we needed to recruit, we were going to have a hard time getting surgeons to come because they are going to go on what they were trained on. Dr. Meredith Angel trained in Philadelphia for 5 years on the robotics, and she was not going to come back to Campbellsville if she didn't have a robot.
As I understand, just from talking with you, many surgeons, if not most, are being trained on robotic devices and techniques now in school.
That's right. And it's going to be even used more and more in the future. OBGYNs are starting to use them for hysterectomies and things like that. And there's now even becoming an application for ENTs to use it as well.
Okay, very good. Another recent step that has just been announced, and you preside, I think, at the press conference announcing this, is the Regional Cancer Center at Taylor Regional affiliating with the University of Kentucky Markey Cancer Center. That is a change.
It is.
And obviously considered a step forward. Tell us about that decision by Taylor Regional and why you think it is a major step forward.
I'm going to give you a little background on our cancer program. Prior to 2005, we were taking patients back and forth to Louisville on a van. And if you're sick, riding back and forth to Louisville every day for cancer treatments, it makes the problem worse. So at that time, when we talked about building a cancer center in Campbellsville, and we had several physicians and an attorney who's jumped up and built the building and put it in place. Since that time, we've been very successful with that. People don't have to travel out of town. We get more compliments on our cancer program than just most any service out there. We have an excellent medical oncologist, Dr. Lasano, and we have a radiation oncologist, Dr. Harden, so people are able to come and not have to travel. But one thing we were missing were clinical trials. And sometimes patients have used up all the traditional means of getting chemotherapy or getting radiation therapy, and they want to try something else. And they were having to travel long distances, maybe to Vanderbilt, maybe to UK, maybe to U of L, and we wanted to be able to offer some of those clinical trials. As being certified by the Commission on Cancer, that's part of our accreditation process, is to be able to offer those clinical trials. So we did some studies, and we felt like that Markey was the best partner for that. They're very excited to be here because they know our excellent cancer program. we're excited for them to be here because we know it's going to offer our patients another level of care.
So it doesn't change any staffing, or the personnel remain the same?
Correct.
The oncologist remains the same, the nursing staff remains the same, et cetera. It simply adds additional services and, as you mentioned, the cancer, the trials that are possible. And Markey, of course, is the only nationally certified, whatever the terminology is, certified national cancer center in Kentucky.
That's correct.
So that adds to available resources and consultation and so forth for cancer patients.
Right.
And one of the amazing things, I think, for cancer patients, just about any treatment can be done now at Taylor Regional, at the Cancer Center here, in consultation, perhaps in some cases with the Markey Center.
Right. Another service that we're able to offer, even before we went with Markey, is we can participate as a hospital in 340B pricing on pharmaceuticals. Cancer drugs are very, very expensive, and there's a lot of families that, it can wipe them out to have to take care of the cancer drug cost. So we have a person actually at the Cancer Center and one in the pharmacy that work to help get medicine for people that cannot afford it. And then they're also able to get it through our outpatient pharmacy at a discounted cost.
That would be for needs-based patients, people that need some assistance and to afford the really expensive type drugs and so forth.
Well, that is true, and then also they are able to get it for just you and I at a reduced price.
Very good.
It's something that people are welcome to come up and talk to John Wilcher at the outpatient pharmacy in the hospital, and he will do his best, and if he can't get it any cheaper.
And I might add, that's another thing that maybe some people don't realize. You can take your prescriptions to Taylor Regional Hospital Pharmacy and have them filled just as you can at any pharmacy in town.
Correct.
So another feature and additional service provided by Taylor Regional. What do you consider to be the major strengths of Taylor Regional Hospital?
The staff.
Okay.
Physicians, as I mentioned before, we're so fortunate to have such a wide array of physicians and very talented physicians. A lot of them were chief residents in their specialty, and they have chosen to come back home or for some reason to come to this area. And then the staff as well. Most recently on Friday, we had our oldest person retire, not oldest in age, but oldest in number of years there. David Galt had been at the hospital 51 years. He retired last Friday. We hated to see him go, but we're proud for him as well. He worked at the old Rosary Hospital on the very first day that Taylor County Hospital took it over. So we hated to see him go, but we've got about 750 employees. We have what we call a quarter century club, which is people that have been there 25 plus years. And there's over 80 people working there that have been there 25 plus. And so the staff, the physicians, and then we're just very blessed to have excellent equipment. In my tenure at the hospital, I've never seen the board turn down a request that made sense, as long as it was something that was moving us forward. So on that account, we have very good equipment. We have state-of-the-art equipment. We have equipment that sometimes even in Louisville you can't get a hold of because the physicians choose to use that in their practice, and sometimes there's more red tape in getting it in a larger institution than there is in a small institution. We do cost analysis. We make sure that it's going to make sense, but the most important thing is that it's going to be the best for the patient.
Taylor Regional has officially, your certificate of need is for what, 70 beds?
90.
90 beds.
90 beds.
But healthcare has changed through the years. And on any given day, you're going to be having as many people or more people on outpatient basis as inpatient. Is that correct?
That's correct.
Comment on how that has changed over time and what's driving that and how that's kind of changed the face of hospitals and healthcare in general.
Okay. Well, if you go back to my early days, I can remember when I started at the hospital, it was a 60-bed hospital, but I can remember coming in the back doors, every bed would be full. There'd be people out in the hallway.
Right.
But that's back in the day when you had your gallbladder out and you came in and stayed a week and you had a large incision. Now you come in and you go home with 2 or 3 Band-Aids, and you go home the same day. Same thing with childbirth. When my daughter was born, I was in the hospital for 5 days. Now, most people go home 2, 3 at the most. So insurance has driven a whole lot, but more than that, technology has driven that. Most things are now on an outpatient basis. I know some people remember Dr. Winnett. I love Dr. Winnett. He was our pediatrician. He was our #1 admitter for many, many years, because if the child had RSV or if they had a temp, he put them in the hospital until they did not have a temperature anymore. Now, insurance says no, they have to fail outpatient therapy first. They have to have 2 disease processes going before they can even be admitted. So you don't see peds in the hospital very much anymore. Now what we're seeing in the hospital is the sicker patients. They're going to have, something that could be potentially life-threatening, or could be something, an infection they need to get over, that they can't be treated on an outpatient basis. One of the fastest growing departments in our hospital is our infusion therapy area. They do all day long infusions on an outpatient basis for people who need IV antibiotics, but they're not admitted. They come get their antibiotics and then go back home. So it's better for the patient.
Sure.
Because being in the hospital, it's not a place to get much rest, that's for sure. So if they can come and get their antibiotics, go back home, sleep in their own bed, I think it's better for the patients as well.
And then you have clinics in other towns.
We do.
Do you not?
We do.
In
Columbia. We have two locations in Columbia.
Okay.
One is in Dr. Loy's building, which is located across from the new Walmart. Some of our specialists rotate down there every week, and then we also offer x-ray and lab. And we did that to not only help out Dr. Loy's clinic when he has a primary care center there, but also for patients that live over in that direction.
Right.
If they need pre-testing for surgery, they're going to come in and have a surgery, they can go there and have their pre-testing done, don't have to drive all the way to Campbellsville.
Because we draw a large number of patients from that general area.
We do.
Even south of Columbia,
We do.
into Cumberland and Metcalf and other counties there. So the footprint is rather expansive
Right.
of Taylor Regional Hospital. One of the problems in healthcare issues that is really pervasive in our culture today is that of drug abuse and opioid abuse. You see this a lot, don't you, at the hospital and as well as in the various practices of the hospital, the doctors that are employed by. Comment on that, just in a general sense.
Well, I can tell you right now, we're looking to partner with a physician to provide pain management. And it's something that's growing, and we want somebody that is board certified in that, that can help with that, because our physicians say they don't want to be in the pain management business. Right. They want to take care of acute problems, and they want to have somebody to send those patients to. Yes, we see more and more patients that with opioid use or with drug or alcohol, and we're hoping that having this center in town will help us with that. I can tell you they're very strict. As long as people follow the program, they're going to be fine, but they're not going to be, I know sometimes things get a bad name, that it becomes a pill mill or whatever. Right. That's not what we're looking at. We're looking at something that will definitely benefit the patients. And there are people with chronic pain. That need help, and we want to be able to help. And right now they have to drive out of town. They can't get that help here.
But there are a lot of groups working, and I know the hospital is doing its part in terms of supporting those community-based efforts. What are some of the acute health problems in our community, in our state, that I know the hospital follows and often it becomes the point of treatment? Some of the major health issues we face as a community, in addition to the pervasive drug problem?
Probably COPD and heart conditions. Of course, we're in the tobacco belt.
Right.
So a lot of people smoked for many years or may still smoke. So we treat a lot of people that have COPD, congestive heart failure. Cancer is a big treatment just because of the number of specialists that we have here. And another growing problem is something that not a lot of people know about, but it's called sepsis. And it is becoming more and more prevalent where people have taken antibiotics so much that they become resistant to those, and so they get sick, and the antibiotics can't treat them anymore, and so they become very sick, and they end up having to be treated with multiple treatments just to try to get them well.
Major problem.
Major
isn't
problem. It is.
You also have to be aware, even though it's not here at this point, but as we sit here and do this interview, there's a lot of worldwide global reflection and news reporting on the coronavirus, but so you have to be on guard for that even as global epidemics occur. I would assume you have to discuss that and at least be aware of those things.
We have a huddle every morning at 8:15 where all of our managers and administrators meet. The infection control nurse is in that meeting every morning. She's reporting. They are constantly out doing in-services, showing patients what they need to do as far as washing their hands and things to stay on top of. And then they go to meetings to keep up on what the latest is that needs to be taken care of. We are putting our environmental services staff through training so they know how to clean the rooms. So there's a lot more involved than just knowing that it's out there. Flu right now, she made the comment the other day, she said everybody's worried about the coronavirus, but they should be worried about the flu because I don't know what the number's up to, but I'm sure it's over 10,000 people across the nation have died from flu. And right now, we're telling people, stay home. If you're sick, stay home, don't come to work. I know the teachers and the schools are telling kids the same thing because it just spreads.
Now, your board hit an all-time low about a year ago when I came on the board.
Yeah, no.
Who is on the board, seriously, at this point?
Okay, at this time, it is John Miller is our chair. You are on the board as well, and we're very glad to have you.
Well,
and you got reelected as secretary when you went.
I missed the meeting.
Yeah,
Got elected.
That's right. We have Karen Patton. We have most recently added on in January is Shirley Buckner, and she will be an excellent board member as well.
Yes, she will.
And then we have Dr. Ben Cox, who's a local veterinarian. So we're blessed.
It's a good group.
Yes.
And I'm certainly humbled and honored to have been asked to be on the board, and hope that I make some contribution during my time on the board of trustees of Taylor Regional Hospital. Other things, other partnerships in the community. The Taylor Regional, I'm amazed at all the, not just the health care provided at the facility itself, obviously, which is the main mission, of course. But the employees and the staff are engaged in the community. You mentioned some of the things being done. What are some of the other partnerships working out in the community?
Well, we have a very strong partnership with Campbellsville University. Their nursing students do rotations at our facility, which we are very proud of.
We appreciate that. It's important.
And then also there are technical programs such as phlebotomy and CNAs. They also do rotations at our facility, so we are glad for that. You have some professors here on campus that Dr. Rogers, Milton Rogers, is constantly helping us look for potential medical students that are going on to medical school so we can talk to them and try to recruit them back to our hometown. So we have a lot of interaction with Campbellsville University. We also help with their athletic physicals before they start their sports season, and our orthopedics and our podiatrists come over and spend a day and work with the students to try to make sure they're in the best health they can before they get out on the field. So that partnership is very strong. Back in October, we started a partnership with Taylor County School System. We now have 4 nurses and a nurse practitioner in that school system. They have been a great help, I think, during this flu season. They, even while school was out last Wednesday, Thursday, and Friday, our staff went in and worked, so if parents needed to bring the kids,
I heard that. That's great.
they could do it. And they'll see teachers, they'll see anybody. So that's been a great partnership for us. We put athletic trainers in both Taylor County schools and in Campbellsville school system. So, and at no cost to the school system. We feel like if we keep the athletes, if they get hurt there, if somebody's there to take care of them, it'll be beneficial to them in the long run as well. So we partner there. Then we're getting ready to do a health fair at Campbellsville Apparel. Chris has always called and asked us to do one for him every year in February. He pays for it all himself. We do lab testing and PSA testing for the men at that plant because he says it's very beneficial. It keeps its people working. We do a health fair in June. That's open to the public. It'll usually see over 1,000 people, and do lab testing for $15, very cheap. A lot of people tell us that's the only time they ever get their lab work done. So, and we have caught some very serious diseases before. They do PSAs for men, and there's been some men that have come back and told us I had no idea what was going on until we had this $10 lab test done. So we want to be a community partner. Anything we can do to help anybody in the community, because we know we're community supported, and most everybody's related to everybody. So you start talking to somebody new comes to work, and it's like, oh yeah, and that's so-and-so's sister, and that's so-and-so's cousin. It's like, okay.
You know, one of the main you've heard me say this before, but when we moved here in 1977, the reason we moved here was not because of a job I had, because I could have worked and lived in any number of counties with a job. But we moved here because my wife is a physical therapist. Taylor County Hospital was looking for their first physical therapist. Kathy became and started the physical therapy, now rehab department. And to show you how far you've come, you have that beautiful building across the road. She started, as you may remember, working out of a closet.
She did. She did.
But Taylor Regional Hospital has a rich legacy. And I think about some of the people who've gone on to be with the Lord, who were just major players in the founding and establishment and the hard work that it took. You know who I'm speaking of, and I won't start calling names, but their pictures are on the walls at the hospital, and we owe them a great debt of gratitude.
We do. We do. Because at one time, when the sisters decided they could no longer run the facility, there was talk of closing down the hospital and us not even have health care. And some very wise people in this community said, we know if we're going to move this community forward, we have to have health care.
That thought reminded me, came to my mind the other day when the hospital in eastern Kentucky, in the Ashland area, closed with over 1,000 employees. Lost their jobs, and I thought, my goodness, what a shock that is to the employees, to the community, and just how fortunate and blessed we are. Because one thing that we want to stress is that Taylor Regional Hospital is solid, is a very solid hospital in terms of the financial stability.
Absolutely.
It's not wealthy. I don't want to mislead anyone, but it is financially solvent at this point in time.
Oh, very much so.
Well managed.
Well, we have over the years saved money. We don't have a lot of debt. We have some debt that we have on the surgery center, but we try to, when we buy something, we try to pay as we go.
Right.
And so that's been very beneficial to us, I think.
Jane, thank you so much for your time, and appreciate your leadership as the CEO of Taylor Regional Hospital.
Thank you. I appreciate it.
John Chowning with Taylor Regional CEO Jane Wheatley for Dialogue on Public Issues. Thank you.